Hi everyone, I'm Dr. Shreya Soni and I'm here to answer questions from the EndoBelly webinar that I put on with April Summers, and she just joined us. She's going to be posing some of the questions she received since our webinar. And feel free to include any questions in the comments below. April is you just have to request to join and then you'll be able to join in. Hi, Mason. So just to recap, I am a naturopathic doctor. So disclaimer is that my bias is that I believe in the body's ability to heal itself. Endometriosis is a complex disease with causes like infection, inflammation, environmental toxins, even emotional trauma. And together we can work to build a lifestyle that supports your body's inherent healing processes with the goal of putting endometriosis into remission. April, are you able to join? Let's see. I'm just waiting for her to request to come in. A recap of our webinar on EndoBelly. We talked about the right diet for you if you're experiencing EndoBelly. And essentially it's more important like how you eat is more important than what you eat. And by that I mean mindful eating is incredibly important. Preserving the ritual of eating reduces the symptoms of bloating and issues with producing digestive enzymes yourself. But in addition to that, diet and endometriosis, there is some research out there. So things like trans fats have been associated with increased risk for endometriosis, and diets rich in fruits and vegetables have antioxidants, anti-inflammatory processes that help reduce excess estrogens and help with healing endometriosis at the root. And especially because endometriosis is an immune concern, you're going to want to be eating good fats, foods that are rich in omega-3s. So things like raw olive oil, sardines, walnuts, those are all especially helpful. So cutting out your intake of any processed food will be great. I think I see April's in here. It just says, April, you're trying to request. Not sure how I support you with that. Let's see. I wonder if there's a reason why you're not able to join. Okay, there we go. Hi.
Oh, there we go. Can you hear me okay?
Yes, I can hear you great.
Perfect. This little square thing is kind of funny. Let me move my...
Yeah, so I was just doing a recap of our webinar on EndoBelly and some things
Yes.
to try if you are having EndoBelly in the moment. Do you want to introduce yourself?
Yeah, I'm April Summerford. I'm a women's health and leadership coach, everybody, and I am the admin of the Beyond Endo Facebook group. And we've been practicing self-care during this pandemic to really help women with endo and pelvic pain while a lot of the other resources have been down. And just learning and discovering new things about how to heal our bodies.
Great. So thanks so much for being here with me. I know after our webinar, you received a list of questions, and I just wanted to be here to hop on a call and answer them.
Yeah, so we did a really great talk about EndoBelly. We went in depth on a lot of the root causes, which women are still talking to me and reporting that they didn't know that there were so many different root causes to investigate. So that's been a really great experience to help them see that. And so some of the follow-up questions, I thought we'd start with maybe diet, if that's okay, and then move to some of the other more, they have some really good nuanced questions that I want to get to.
Yes.
So diet related, they just wanted to know, you talked a lot about elimination diets. And so they wanted to know more specifically, what did you mean by that? Is there a specific elimination diet that you recommend, from AIP to FODMAPs, paleo, vegan? That was one of the questions.
Yeah, so diet is going to be specific to you. So for example, if you have endometriosis and an autoimmune condition going on, that is when you might consider something like the AIP protocol.
Yeah.
I know ketogenic diet is something you have to be very careful with for women, because some women, it throws off all of their hormones because it mimics a state of fasting, and it deprives certain B vitamins and carbs that some women need for their cycles. And other women, it's great. It's a solution to all their issues. So it's going to be patient specific. But your question was about elimination diet exactly. And that is for if someone is having food sensitivities. Elimination diet is the gold standard. And that involves taking out common allergens. So things like gluten, dairy, soy, nightshade vegetables, which includes tomatoes. Those are just corn. Corn is another one. So those are some of the common allergens that we find people allergic to in the United States. You take out those things for about a month. And then more important than removing these things is the process of reintroduction. So you have to be organized and careful with how you reintroduce these foods, or you kind of miss the buck with the diet. So you introduce in foods one at a time. So for example, if it's you're trying sourdough bread, you're going to have sourdough bread for breakfast and lunch for 3 days in a row, and see if you get any symptoms. And if you don't, then that's something you're able to tolerate on a daily basis. So elimination diets are the gold standard on getting to know what your food sensitivities are. In addition to that, there is, if you have a hard time with implementing that type of a restrictive diet, which is completely understandable, there are blood tests available that look into things like IgE, IgG, and even IgA, which are some of your immune responses to foods you eat. And that can be a helpful tool in determining what you might be sensitive to. So anytime you get food sensitivity, even food allergy test results, so IgE in the blood, I'm not talking about a skin test, allergy test, it's important to scrutinize that data and take it out from a diet. And after a couple months of removing it, you give your gut a chance to heal for those couple months that those sensitive foods are out. And you can do other things as well to heal your gut lining. With sensitivities especially, it doesn't mean that it's not something you can eat forever. Once you heal your gut with a 1 to 3 month protocol, it's possible to reintroduce the foods. I just want to say hi to Mason. Thanks so much for joining. Mason's also an amazing naturopathic doctor out in Ontario. She's a great friend of mine.
Awesome.
Wow.
I see a few of the girls joining too. So, and I think the way they request, I think I was just playing with it. They click that little question box right at the bottom. So if they have questions they want to ask live, I think they need to click that button, type in their question, and then we can answer their questions as they come in. But I have all these pre-submitted questions from the group that I'm going to go through while people are, coming up with their questions and submitting them. So the next question was related to the elimination diet. One of the girls wanted to know just where to start. She was feeling overwhelmed. She didn't know what to do. So when starting this whole process, is there certain food, like you just mentioned, the really top food groups people tend to have immune system issues with, but do you have a certain way that you have women start the process that kind of eases them into it? Or is it a hardcore detox elimination to start with and then from there?
Yeah, and it depends on who you are and what your circumstances are. So for example, if you're someone who's flying for work, which I know nobody is right now, but there were people with that type of lifestyle. Yeah. With that type of person, I might start with the blood test, and that is actually something that you can do while you're at home. We have blood spot food sensitivity tests. It's under $200 with US Biotech, and the kit gets shipped to your house. You do the blood spot, you ship it out, and you get to find out what your food sensitivities are. And then you can start right away with taking out those foods that showed up in the labs, taking them out for a period of 1 month at least, and then practicing food reintroductions to see if those are actually foods that don't work for you, or if it just happened. These tests are not the most accurate, so if it just happened that they mimicked some other immunoglobulins in your body and that's why they were flagged.
Okay. And then if they're not able to start with that blood spot, which I actually do also highly recommend testing, because it can get really frustrating to not know at least where to start, or at least that was in the case for me. But if they're just like, okay, I'm just completely coming to the table, can't do the test right now, is there certain food groups? I've talked about in our group, sugar, gluten, like you said, nightshades. We talked a lot about nightshades this week, stuff like that. So what do you think is the best place for them to start so that she can get
on that? anything that you have ever suspected for yourself, because a lot of people, there are weird foods that they're like, hey, I think this doesn't work for me. That is definitely going to go on the list for you to try with your own custom elimination diet. But in addition to that, like you said, the top allergens for people in the United States specifically are gluten, dairy, soy, corn does flare some people too.
Okay. Yeah, me and corn don't get along. I found that out the hard way. I was eating a lot of corn when I went gluten free, and then I had like the world's worst corn allergy. And I'm actually pretty sure that I'm really allergic to corn, so I just stayed away from it. It's better that way.
Yeah.
I don't my life. Um,
So for
so
me,
with that,
corn has come
oh,
up
go ahead.
in some corn came up in some food sensitivity tests
Yeah.
for me personally. So
Oh, you did too.
I
Okay.
yeah, I do everything on myself too. And so I was able to keep it out for some time. I don't get any symptoms from it. And I had so many food sensitivities show up for me personally that I could tell for me it was more of a leaky gut picture. I needed to heal my gut lining. And working that way, I was able to then put back certain foods. But how I practice it now is that I know that, okay, corn showed up in a food sensitivity test. That means I'm just going to be a little more cautious with how it's in my diet. It's not going to be something that's there more than twice a week for me if I happen to eat
Yeah.
corn.
That makes sense. And honestly, like corn isn't for me personally, like I have other tortillas and stuff I like now. So corn is not like the end of the world to cut out as far as it's not like in every single food. Anyway, so that wasn't so hard and it was a top red for me. And that was after I had done all my healing and everything. So I just don't think me and corn get along very well. So I'm like, it's okay. It's okay. I can break up with that. I'm all right with it. On the
Yeah.
dairy
And
question, since we were talking about allergens, there was a question about dairy, but
well,
go
I
ahead.
just want to mention one more
Yeah.
thing with
Yeah, go ahead.
corn that ties into sugar. The high
Yeah.
fructose corn syrup, that's also part of why corn is triggering for so many Americans because that has been a part of our diet and it's something that nobody needs to be eating. It
Right.
mimics sugar, but it just causes all kinds of inflammation. So part of why so many Americans are sensitive to corn is that we have corn snuck into all kinds of foods that we don't realize in the form of high fructose corn syrup.
Yeah, that makes sense. I was talking about condiments this week. That was my big theme this week. And we talked about how ketchup is a very large condiment that has high fructose corn syrup in it. And it was something that even my sister, I went really hardcore. My sister is still dabbling. And she was like, can you believe there's high fructose corn syrup in ketchup? I'm like, yeah, that's kind of ridiculous. Like, it doesn't need to be there. So, that
Yeah.
anyway, we talked about some ketchup swaps on my page that girls can look into that don't have high fructose corn syrup in it. But it is kind of
That is
crazy how
really
it's
good to
not
know. Mm-hmm. And this is a uniquely American problem. The same companies create products that are cleaner for Europe and for other countries in the world.
That's crazy. And like, there was a girl this morning. In fact, she has a question about dairy, which I'll just go to her question now because it's a good segue to her. But she lives
Okay.
in France right now, and she's from the UK. And she was asking about dairy, and I told her I was kind of jealous because actually, when I go abroad, I can eat a lot more foods because they just aren't
Yeah.
contaminated with all these types of things. And even their
Mm-hmm.
dairy is cleaner. I've noticed their bread is cleaner. Like I don't do well on bread, but I can kind of do European bread, and I think it's because it's not genetically modified, doesn't have all these other funky things going on. So it's interesting that you mentioned this is a uniquely American problem with some of these foods that we're looking
Yeah,
at.
definitely. I can tell you there's multiple different species of cows, and especially the ones native to India, they are parts of research trials now to see if it makes a difference. And I think in your grocery stores now, you can see that A1 milk that is from this different species of cow.
Oh, okay.
So yeah, some of the food sensitivities in the United States, they have to do with, the animal used, how we take care of the animal, what we're feeding it, the animal's lifestyle. And also when you talk about bread, so for example, sourdough is something that a lot of people are making at home now. And the more you ferment it, the less gluten it has. So that
Oh,
can be why some people are better able to tolerate it. But it's not across the board. I know plenty of people who are not able to tolerate sourdough. But when we talk about bread in the United States, the process of fermenting, so making it take 20 hours to produce a loaf of bread versus like it's done in a factory and it's a quick process that makes a difference in why we're not able to tolerate it.
that makes sense. And obviously, if all of that breaking down and fermenting was happening before your digestive system ever got it, it's a lot less work
Mm-hmm.
on our system, right? To have to break down
Yeah.
all those proteins. So that makes a lot of sense.
Yeah.
Yeah,
That's a
I
great
love that
point.
stuff. It's fascinating. So her question, the girl from France, she wanted to know, she's recently been doing a FODMAP diet, and she'd seen a lot of relief, but she did have some brie cheese recently, and she did have quite a flare. And so she was just wondering, like, why dairy does that. I think her question was more into the why behind, why is dairy an allergen for some of us, and why is that difficult on our immune system?
Yeah, we could talk about the lactase enzyme itself and how, people who are Asian are less likely to have that lactase enzyme, and you have more dairy sensitivities with anyone from that genetic group. But there's so many reasons for why someone may not be able to tolerate dairy. I think what you mentioned about FODMAPs itself is good to get into. So so that's a specific diet where you keep out foods that are high in fructose oligosaccharides, which are a specific
Yeah.
type of sugar. It is a very strict diet, so it's definitely not a long-term solution, but it can provide short-term relief. But along with FODMAPs, some things that you have to think about are, is there overgrowth of bacteria that is why you are feeling better with the FODMAPs? And then what are some strategies to help with clearing out this overgrowth of bacteria? And so that can be enhancing motility in the gut. It can be supporting the liver and gallbladder with sending out bile to support that motility in the gut. Or, it can involve a stool test to see if there's overgrowth of certain organisms. But so I see FODMAP definitely as like an acute solution, but it's not sustainable long term. It's an extremely strict diet. It's a hard way to live if you're on the FODMAP diet.
And how long is it needed if you are actively clearing out and doing all the things you just said? Because obviously there's things that need to be done to heal that bacterial overgrowth. And there's tons of studies that women with endo tend to have small intestinal overgrowth, right? We tend to have SIBO issues. Yeah. So what is a time frame that she could do that for before it would actually start to be a problematic issue? Because we talked about that on our endo belly thing, and I think we should keep bringing it up, is that we can't live on these diets forever. They're supposed to be cleansed diets, and then we're supposed to be able to reintroduce and allow our gut to start getting stronger and healthy. We can't eliminate everything forever.
I'm going to be honest, I rarely advise a FODMAP diet to anyone because I start with treating that cause piece. I start with supporting the liver, gallbladder. I start with healing the microbiome, the intestinal lining, so that your food sensitivities aren't as many. But I often have patients come in who are on things like FODMAP that are helpful. And when we start healing at the root, they find that they can go off of something like FODMAP. But how long should you be on something like FODMAP? It's relatively safe, but you do have to consider nutrient deficiency. So you should be testing for your nutrient levels. So things like B vitamins, vitamin D, iron. It's important to keep in mind if you're on it personally for a long term. But yeah, it's going to be person specific how long you choose to do the FODMAP.
Okay, well, that's good to know too, that there's this whole other option where you could just start from square one, go to the root issues, and not go through this huge elimination diet process and actually know why you're doing what you're doing. Because I feel like I did a roundabout way. Like I did all these strict diets and was like, I can't live like this. And then I got to the root issues eventually, and I found practitioners like you, which I love because you help us understand like what's really going on. And then I knew like, oh, well, I can reintroduce these foods. And all of a sudden it was funny. My husband especially was like, this is so nice that you can eat with me again. Like you're not eating all these really weird things, and I eat really healthy still, and so they tease me about that too, my family. But he's like,
yeah, I hear that from patients every day. So especially women who've been on birth control for a long period of time, their gallbladder and liver are strained, and that can be part of why they experience things like bloating and pain after meals. So we do things like support bile flow through the liver and gallbladder that helps clear out hormones, that also deals with their digestive issues, and they're able to introduce foods back in. And their family members are like, it's nice not having you in pain every day. And yeah, it's life-changing for a lot of people.
Yeah, it is. It's the little things. You start to appreciate them. Like I can eat a meal with my family. That's really nice. I don't have to eat some weird concoction. So I think we answered her question. I think also, like you said, so there's actually a difference between like lactose intolerance. I just thought I'd bring up because it's an interesting topic.
Yeah.
Lactose intolerant, like some people legitimately cannot have lactose or casein. And so they have serious issues with those, right? Versus a poor, like there's a high quality dairy and a poor quality dairy, I've noticed. So like I can have really high quality hard cheeses from time to time and I don't end up with issues. But if I eat Like brie's kind of hard because it's a soft cheese, and if it's also from a cow that wasn't real healthy or has a lot of hormones, then I feel it almost immediately in my system. So do you want to talk about that a little bit?
Yeah, so just like you said, if you have lactose intolerance, you can't handle dairy. So dairy is not part of your diet in that extent, but we do see with a lot of dairy sensitivities. Um, and so by that, I mean, if, women with PCOS, dairy can be part of why these symptoms are going off. There's some nice studies on removing dairy and gluten and how it can be helpful to your hormones. Other parts of that picture are that there is growth hormone in the dairy from cows. So, that's going to affect proliferation involved in endometriosis.
Okay. And any reason why, I kind of read about it a little bit, but any reason why, like the soft cheeses and the hard cheeses, why are the hard cheeses, is it part of the aging process? Is it part of that process again that makes it a little bit, does it degrade
Yeah.
the protein?
Yeah. So I honestly, I learned that piece from you. I didn't realize that, hard cheeses can be so much easier than soft cheeses, but it makes sense because those bacteria have had a longer time to break things down to make it easier for you to digest. But again, if
Okay.
someone's lactose sensitive, if they
It's
don't
not
have
going to matter.
lactose enzyme, they couldn't, yeah, it's not gonna matter. They're gonna have
Yeah.
diarrhea
And I
and
did tell one of the
cramping.
girls too, if you're not lactose intolerant, but you're once again having a temporary issue with it, I do take digestive enzymes before I indulge in a little bit of nice quality cheese. And I noticed that
Mhm.
that works just fine. And I don't have any symptoms and I'm good. So I don't think, like, she's in France. I told her, don't eliminate cheese when you're in France because you probably have some really high quality cheeses at your disposal, but take some digestive enzymes and just watch how you feel and don't overdo it, right? Because it can cause a hormone imbalance.
Yeah, I think you nailed it. Those are the key points. Enzymes are definitely there for you on an as needed basis. They're not something to do long term, 1 to 3 months max, as well as supporting your own ability to produce enzymes is really great. And I know in our video we talked about apple cider vinegar and mindful eating for that. Yeah, and then on an as needed basis, if you know you're going to eat some gluten or eat some dairy, there's some good digestive enzyme products to help with metabolizing them.
Yeah, there's a gluten one. I'm still like, I'm still leery because me and gluten are not friends. But I did try one Christmas gluten enzymes, very specific one for breaking it down, right? And I had that, and then I had like a little piece of pie or something. It was kind of like eh. So I think it depends once again your body, right? Like I'm super sensitive, so I'm not so great. But I have hope that other women, like how I can do with dairy, could have an enzyme and maybe be a little bit better at digesting those things
As well as
if
when
needed.
we get the practices in place for healing that intestinal lining, they can feel a little bit better. So, some of the top things used to heal the intestinal lining, colostrum is one of those. And people who are sensitive to dairy often ask, is it okay to take colostrum? And so, colostrum doesn't have lactose in it, especially if you're using a very high quality colostrum. So it can be okay, but I would always just do it at a very small dose and see if you're able to tolerate it. And if you are, it can be like a great resource for helping with healing that gut lining, reducing sensitivities, so that you're able to handle these foods when you have them once in a while.
That makes sense. Okay, that's a good tip there. I'm trying to see. So, okay, I think we pretty much covered that. We covered the elimination diet question. Oh, I love this question. So, how does IBS come into play? And while we're talking about gut lining and gut health and all that, is IBS even real? Like I've been wondering this for a while now. Like IBS just says, "Oh, your bowel is irritable," but that tells me nothing about like why it's being irritable or what's causing it. So, what is your take as a naturopath on IBS? Is that a BS
Yeah, I mean,
diagnosis or what?
it
What
is
is that?
to me it's a BS diagnosis. It's someone is just saying that anxiety makes your digestive symptoms worse, and we know that's the case because your parasympathetic system is so much rooted in your gut. So anxiety makes everyone's digestion worse. It doesn't mean that you've solved the problem for them. But people with IBS often do take herbs to help them with their symptoms. So there's a lot of digestive herbs that are in a lot of traditional diets, but not in the American diet. So things like fennel, ginger, coriander seeds, cumin seeds. So Indians are cooking with these foods, and so when they're eating food, they're getting those herbs. But in the United States, people with IBS, they do find relief when they take these blends of herbs. And that's important. That's helpful. That's going to help you digest.
That's awesome.
And that they
I've
also use
actually
different
gotten
herbs
better
to
at
help with
cooking
treating
with herbs.
anxiety. If
Okay.
Yeah, yeah. And so it's person specific, but you have to see, is it the anxiety here that's causing the digestive symptoms, or is it the digestion that is causing the anxiety? Because they can both feed each other. And so the basics for helping someone who has anxiety triggering digestive issues are like, please make sure you're having a breakfast that is rich in healthy fats and healthy proteins, because it's going to help keep your blood sugar stable. It's going to give you what you need to make the hormones to reduce symptoms of anxiety. If you're having blood sugar crashes, that's going to make anxiety worse.
Yeah. And so I think that that's actually like, once we peel back the layers, I think that's really what's going on. Like with her question is like, well, why do women with endo tend to be told they have IBS? And I think it's because we have, most of us have HLA SNPs, which is our gut lining SNP. So our gut lining tends to be leaky if we're not doing what you're saying, caring for it, watching these things, cooking with herbs, eating mindfully, chewing, all these things we were talking about that us Americans aren't real great at. We eat while we're in the car, we eat while we're on the computer. We're not great at paying attention to our food. And then I think the
Yeah,
other
and just for I just want to say, like, for anyone who doesn't know what SNPs are, those are genetic mutations that make it easier for you to have some of these issues. And with endometriosis, and even breast cancer and the other hormone related conditions, they have seen exposures to environmental toxins. So that could be heavy metals, that could be plastics, that could be pesticides, make your genetic SNPs worse and aggravate these conditions, lead to these conditions.
Yeah. And I told just a few weeks ago the girls on my forums that it was not very uncommon for me to play outside in the orchard and the plane would come and just spray pesticides right on me while I was out in the field.
Oh,
And it's like, yeah, so I don't really want to know how much dioxin exposure I had as a kid, but probably a lot. And then our diet just continues to expose you to that, over time. So I do think the chemical load, the environmental toxins, huge. And there's tons of solid research on that in the literature that shows it's related to endo and hormone related conditions. And then I
yeah,
know
and it's
I have
possible.
HLA SNPs. So
Yes, HLA SNPs. So you're going to be more sensitive to gluten and dairy, because HLA SNPs are something that predispose you to autoimmune conditions. And so those food groups are definitely implicated there.
yeah, so I think it's more that, and I think it's more that we're kind of a little more sensitive, gut lining wise, and we probably have some of the other SNPs too, which we could talk about that on a different day if girls want to nerd out with us about MTHFR. I have double SNPs and MTHFR. I have one in COMT, which means I don't process estrogens as well if I don't keep it all in balance. So I think a lot of endo girls have those types of root issues and then all these other things versus just some doctor saying, oh, well, you have an irritable bowel, which isn't really helpful. It just isn't a helpful diagnosis to me. So anyway, that was kind of her question about that.
And I just wanted to add, like, if you have been exposed to things like heavy metals, pesticides, it's possible to test for that, but it's also it's possible to heal from that. It's a matter of supporting your liver detox. Foundations of detoxing are making sure you have daily bowel movements. That prevents you from reabsorbing estrogens, for example, that should have been eliminated. But also liver support. This is the wood season in Chinese medicine. Springtime is the wood season. So it's all about loving your liver. And it's easy to do that through diet. Things like beets, artichokes are really helpful. Also sunflower seed powder, lecithin, it helps with emulsifying bile and draining out the liver.
Yeah, and us girls with endo, we need to love our liver all the time. So it's definitely a good time to focus on loving our liver because it gets rid of all those estrogens and, like you said, all the chemicals and everything. So it's a big deal. Mm-hmm. Let's see what else we got here because we did FODMAPs. Ooh, let's talk about this and then we'll come back around. I want to do an advanced question. We'll go back around to a simple question. So advanced question would be, you mentioned in the video infections. So what types of infections tend to underlie when you watch women with endo? What are these infections?
Yeah, so the research has shown that women who have had different types of pelvic infections in the past are at a higher risk of endometriosis. But it is very patient specific what types of infections I might check for. And it also depends on what your symptoms are. So someone having lymphadenopathy, which is enlarged lymph nodes, periodic malaise, fatigue, flu-like symptoms, I'm definitely going to screen for Epstein-Barr virus. So this is Epstein-Barr virus is known as mono. That's the common name for it. 9 out of 10 Americans will test positive for being exposed to it, but very specific people will have high antibody titers to it, which means that this is still an infection that you're fighting at the present moment. If you have high levels of IgG and even IgM, then it's something that is reactivated. So we would support the immune system in handling Epstein-Barr virus, but also just strengthening your immune boundaries are going to be part of the protocol.
Okay. And I know for me, when I went back and I was looking for that smoking gun. I knew there was a few different things that tipped me over the edge, but I was looking for that gun. And for me, I was pretty sure it was Epstein-Barr, because when I did the test, it was like, oh man, you had a major Epstein-Barr problem, and I had to calm that down and heal my immune system. Any input or insight
Yeah,
on
so viruses and chronic infections are a crucial part of why the immune system may be going whack in endometriosis in the first place. Because endometriosis is an immune condition.
Right. And that's interesting because it took me years to even get to that point. And so I think it's, again, kind of weird that at the doctor's office, you're kind of like patted on the head and no one ever said, well, anyway, if I could go back and have a conversation with my doctor the very first time, they should have said, well, let's look into this. And you're really stressed out all the time and you're not eating well and you're not sleeping. Your immune system's crashed. What's going on? And maybe they would have found that I had an activated Epstein-Barr, issue going on. And with Lyme disease too. A lot of girls with endo have Lyme disease, it turns out.
Yeah, it all, Lyme disease, mold, other viruses that can be implicated are HPV, CMV, parvoviruses. But either way, if you're presenting with this immune system, something comes up, things like mold, it's important to make sure those are out of your immune system. And out of your environment. If you have mold around you, you're not going to be able to heal. But some of the other conditions, including Lyme, and if it's chronic Lyme, not if it's acute Lyme. So Lyme is a tricky one. If you have recently been diagnosed with it, antibiotics are going to be crucial to making sure it doesn't progress into a chronic condition. Sometimes antibiotics are intravenously administered. But if it has moved into that more chronic state perspective, it's the same immune regulation piece, supporting your immune system and handling infections in general. That's really important.
Okay.
And it's going to be patient specific, but things to keep in mind are vitamin C is really helpful.
Yeah. And I know, for me, keeping my vitamin D levels up, keeping my vitamin C levels, keeping my glutathion, those things really keep my immune system running and happy. But
yeah, and I'm going to add a little disclaimer about I'm going to add a little disclaimer about vitamin C, because I know a lot of people are taking it now that may not need it. There are different types of vitamin C. The one that is from food sources is called ascorbate. The one that's made in a lab is called ascorbic acid. The way you take it, whether it's buffered or if it's liposomal, that's all going to matter in increasing absorption and also making it more tolerable. If you take too much vitamin C, it can contribute to diarrhea. And right now, when everyone is self-medicating with vitamin C, the type you take, like I mentioned, matters. Also because if someone has kidney stones, vitamin C can make that worse. And actually, people on taking vitamin C have had higher risk of kidney stones.
Okay. And is that so much not with the natural source, though, right? More with the supplementation for that? Okay.
So I don't think the article distinguished that, but you can definitely pop it into Google and see that. The thing to keep in mind is even something like vitamin C is something that you should be discussing with your doctor, considering your personal health profile and seeing if it's right for you, and then what is the best way to be taking it, what's the right dosage for your body.
Yeah, that makes total sense. That's the other thing I learned about supplements is I did a lot of it myself because I just didn't have anybody to do it with. And then once I started doing it with an actual doctor, it was a very different experience. It was like, oh, you're taking way too much B6, or you're taking way not enough of this. And I was like, oh, and so they completely readjusted it. And then my life got much better. So it is really important to work with a doctor who understands these things to really get the right calibration of what's going on. Which kind of relates to this question that just came in this morning. This new member of the group wanted to know about mineral imbalances. She says she has symptoms. She doesn't know if it's related to endo or not. She's trying to figure it out. She's been doing a diet change and supplements, but how does she test for her mineral levels in her body to know if they're balanced or
Yeah.
not?
So any doctor can order you a urine toxic and essential metals profile with, and so one of the labs I use is doctor's data. But again, it has to be indicated for you. So if you are having things like thyroid symptoms, getting to know your levels of selenium can be very important. If you're having symptoms of like sugar cravings, chromium can be very important. So it's going to be person specific. Your doctor's going to see that it's actually indicated for you. And then it can be a very helpful tool to get toxic and essential metals and minerals tested.
Got it. Okay. So she just needs to find a practitioner that understands that and then can help her pull those tests to go through. Okay.
Yes. Yeah, so a practitioner that understands that. I'm a licensed naturopathic doctor, so this is something that we focus in. There's a difference in the different types of providers out there. So whoever you see, it is helpful to look at the credentials. I did go to 4 years of medical school. You can look up my medical license. I've had people who go to providers who call themselves naturopaths. And that's something in California, anyone can call themselves a naturopath, whether they've gone to medical school and done residency or not. They might have done a weekend course. They can call themselves a naturopath. But you know, you're not getting the same level of care. You're not getting the same service. It's a very different experience.
Thanks for mentioning that, because I know now that there's an emerging field, so naturopaths are really on the scene and functional medicine docs are on the scene, but there is a lot of distinctions. You have to understand the difference between people who have legitimate licenses and people who are just like, oh, that's the new thing to call myself. Like there's a guy in town I even know locally where I live, he calls himself something he's not if you look at his credentials. I'm like, you're not certified to call yourself that, but he does. So, and
yeah, so you do have to be very careful with who you see.
Yeah.
And I have a lot of patients who've, you know, been to someone who may not actually be a naturopathic doctor. They'll come in taking 20 different supplements. And the first thing I'm doing is having them stop everything because that's not what their body needed. You know, the person did not figure out why the thing is going on with you if you're taking 20 supplements.
Yeah, and that shouldn't be like forever. It should be how you're, like you said, how you're figuring that out. Yeah, that's good. That's. I'm glad you brought up that distinction because that's a very important distinction. Let's see. We did IBS. She did minerals. Do we have any questions submitted? I don't want to ignore anyone that's on live that submitted questions. Did anyone submit?
I haven't seen any questions come in, but I have seen a lot of support from wonderful people. Just saying that they're loving the content. So thank you so much for everyone commenting.
Oh, this is a big one. I had a girl that is having loose stools every day and she doesn't want to live on anti-diarrhea pills. So what does she do, or how does she start the process to investigate what's going on there? Because I know you talked a little bit about diarrhea on the EndoBelly webinar too. Yeah,
so has she seen, it sounds like she's seen a doctor for the loose stools because she's been prescribed an anti-diarrheal. Because the first thing is to see, is it actually an infection of E. coli that's causing the loose stools, for example. Taking a look at your stools, seeing if there's any blood, mucus, what is actually there is going to be very important, and your doctor is going to want to know that information. So definitely track that. And then you have to figure out why the loose stools are happening. So it's again going to be different person to person. So one thing it could be if it's related to her period, it can be part of the cytokine storm that happens when your body's putting out these immune regulating things that help just release your endometrial lining, and as a result also cause diarrhea. So that is something to look at if she's an endometriosis patient. Another piece could be sometimes this diarrhea can occur because aggravated liver and gallbladder. And so that's going to be important to assess. There's also strength of the rectal sphincter. That's a whole piece we could look at. Yeah, so it's definitely person to person. I need a little bit more information than just the loose stools all day. Yeah, sure. But I'm really sorry that's happening.
Does she have to live on anti-diarrhea pills? We'll know if she gets to the root causes. It's kind of like the answer that I hear you saying. And then obviously I would need to know more to really get her on track with, is it an infection?
Yeah, so for example, yeah, like maybe she's just sensitive to dairy and dairy's in her diet right now, and that's causing all the loose stools. So it doesn't sound like the why has been figured out for her.
Yeah. Okay. So she needs to dig deeper and find out why that's happening. And then, yes, she can live without anti-diarrhea pills in the future.
Mm-hmm.
So, okay. Um, let's see. Oh, this is a good one because this is kind of one where conventional medicine has a very different opinion than naturopathic and sort of root cause medicine. So, one of the girls, she's only 19. Her doctor says that and I hear this a lot. So this one's kind of a pet peeve for me a little bit too. Her doctor is scaring her a bit and saying that if she doesn't get on birth control right away, that she is going to be a high risk. It's going to be a high risk to her fertility, and it will preserve her fertility if she isn't on birth control. So is that true? You know, why is this still happening that doctors are scaring women on birth control to solve problems that they're actually not solving? They're just masking symptoms. And what is your take on what she should do about that? And obviously I just said my own opinion on that. So I have my own opinion.
Yeah,
That,
so yeah, birth control
you know.
is a tricky topic. And so my bias is going to be I believe in the body's natural ability to heal as a naturopathic doctor. So I definitely have that bias. There are studies that show birth control in endometriosis reduces risk of ovarian cancer. But at the same time, the American Cancer Society will tell you that it increases risk of breast cancer and it increases risk of cervical cancer the longer that you take it for. So once you get to 5-10 years, those risks are increased. Doesn't mean that the risk doesn't go away. If you stop birth control, your risk will come back down. So if you've been off birth control for 10 years, the risk of those other cancers comes down. So with birth control, the biggest thing to me is getting informed consent from the patient. So explaining to them what birth control is, and essentially it is stopping your brain from communicating with your ovaries because you're putting in the hormones. So your body is going to be ignoring those natural hormones that are produced cyclically throughout the month. So your liver clock, for example, that's supposed to be timing these hormones, that is totally silenced during that time period. It can be helpful for women, especially if you're using it for contraceptive purposes, or if it's helping you with your hormones and pain relief. That's really important. The length of time that you stay on it is going to be important to discuss, as well as just knowledge and informed consent about some of the side effects. So you mentioned someone who's young. So there was a study done with women aged 14 to 30 years, and the duration of being on oral contraceptive pills was associated with lower bone mineral density because those are the years during which you're forming your bones. And so to summarize, women who are taking birth control were less likely to have dense bones, which is really important when you get into menopause and your estrogen levels come down. And you're at higher risk of bone fractures. So that is something to keep in mind if you're an adolescent going on to the birth control pill. In addition to that, you absolutely should not be smoking if you're taking the birth control pill because it increases risk of clots and stroke. So that is another very important thing to keep in mind. And then other things that sometimes go up with birth control pill would be depression. And they've actually seen the hypothalamus change shape in women who've been on birth control for a while. It shrinks a little bit. And so aggression is associated with that symptom. And again, going back to clotting, if you have any family history of stroke, for example, or clotting disorders like factor V Leiden, it's a genetic mutation that you should be tested for if you're going on to birth control. Then birth control is not the solution for you.
Yeah, and that's one of my beefs is like, why aren't we more serious about screening for that? Because I've actually heard of stories of people, this is on the more horrific side of things, but I've had stories of couples who have lost their young daughters now because they had those factors. Someone put them on birth control without ever screening for them, and they ended up with an immediate aneurysm or something like that. And so because of the clotting. And so anyway, it's just kind of crazy to me that we're still kind of handing out birth control like Tic Tacs and we're not doing the appropriate screening. I know I was never screened for those things before I started it. And I had severe reaction. I'm lucky that I didn't have more severe problems, but I had very severe problems on it. And now I know why, because I know my genetics and I know I should have never really been put on it. But anyway, my other problem is that it's like a Band-Aid that doesn't work. It masks symptoms, doesn't tell you what's going on. And then we lead to this delay in diagnosis where girls could be getting these root issues dealt with, but it's going on for years because the birth control is just shutting down that signal and not telling you. So anyway, those are my two big beefs.
Yeah. So if she did feel better with something that with this, and there's different types of birth control. It sounds like the one she was on, especially if she's endometriosis, it has more to do with progesterone. There are ways to naturally boost your progesterone levels and treat something like estrogen dominance. And so even if you're taking birth control, it's going to be important to have that conversation. So if you're taking birth control, another thing to keep in mind is that it does deplete your B vitamins, it depletes magnesium, it changes your microbiome. And so there are certain nutrients that you need to be more regular with. And a good formula, for example, is called OCP Companion by Vitanica that I like
Oh,
women
I love
to consider if they're
that.
on. Yeah, birth control, it also has some liver loving foods, liver loving herbs in it. So that's really helpful. But yeah, so if birth control is providing any kind of symptomatic relief, that tells you that supporting your natural progesterone is important. And you can support your natural progesterone with a number of tools. There are dietary seeds that can help boost it. There's things like, there's also dietary fats like evening primrose oil, GLA, and then there's progesterone by itself if you still need it. But I always start with, why is the progesterone low in the first place? Is estrogen dominance happening? So if estrogen dominance, so that's when your body has too much estrogen and not enough progesterone. If that continues for a long period, it does have increased risk of your hormonal breast cancer. So it's really important to treat that and support clearance of estrogen
Okay.
early for whatever.
Okay. And if I hear you right, and that's kind of what my belief system is too, that you really should have some baseline tests done to really see what's going on and really get to the root of that. And if that is still all in play, I'm totally with you, with complete informed consent, then maybe that is a good option for her to
Yeah,
go right
it's a tool. It's a tool that we
Yeah.
have access to. But yeah, have your timeline in mind. So are you planning to be on this for 10 years? Like what's it going to look like for you?
Yeah. And I
And
just think, like, once again, the 10-year thing drives me nuts because, like, so many women have symptoms because endo and these underlying infections and inflammation don't go away. It's just that your brain isn't talking to your ovaries. So you're just not aware of what's going on. And so that's my
yeah,
biggest beef. I've seen women with severe disease that I'm almost positive wouldn't have been that severe if someone would have got to it sooner, but she was on birth control for so long, she didn't really know. And then it became a bigger issue later.
yeah, you're really right about treating the cause there.
So, okay, so she has options. She can look into that and see what's best for her.
Yeah.
And we should have a talk about birth control just entirely one day because it is really fascinating, and especially with the nutrient depletion part. Because another thing that no one ever told me is they put me on birth control, and then I started having psychoactive symptoms, and I do think it was because I'm already at a high risk for B vitamin depletion, and then I'm on birth control, and I was having, like, it was weird. My neurochemicals, I could tell, were not balanced. And so when women say that that's a real symptom, they're not joking, because you can really, like, start to have some neurological stuff going. You're like, okay.
Yeah, something for anyone on birth control to keep in mind is the emerging post-birth control syndrome. So there's a good book on it called Beyond the Pill, but a lot of women found out about that too late. So when they stopped birth control pill, they got a flare of all kinds of symptoms. Yeah, so for some women it helps with preserve. Oh, you have it. Great. Yeah,
I
it's a
love
good
Dr.
book.
Jolene. This was
Yeah,
only
she's
published like
wonderful.
a year ago. So, like, I had to learn all this stuff myself. I was like, thank you for publishing it, Dr. Jolene, but I learned this all on my own the hard way because it just got published. But for any woman now, that's a great book.
Mm-hmm.
I didn't mean to cut
All
you off.
right. No, I think we're getting towards the end of our time. So
Okay.
I don't think we've gotten any new questions in our chat, just a lot of love and support, which is really
Okay.
nice to see. But were there any final things you wanted to bring up or ask?
I'm just looking to make sure I got all my girls' questions answered. I think I did. So, where to start? We did FODMAPs. We did a little bit about birth control. Talked about infections. I think we covered all the major topics they had. I think this was a really good discussion. Hopefully it blows a lot of their minds and they have a new perspective on the types of things to look into and the types of doctors to partner with to get really good quality answers. Because I know I'm just, like I said, I feel like I had the ringer on this, and I kind of wish that I had this problem now moving forward, because there's so many better doctors, resources, and things that girls can do now that I didn't have back then. So I'm already sounding like an
And
old
the
person.
other amazing thing is like also the amount that you've healed. Like you've been through so much, but you've healed through all of that as well.
Yeah,
So that's
it's
another
possible.
key piece. Yeah.
Totally possible. And so that's a whole nother talk for another day. But anyone who says, well, you're just gonna have to accept your plight, which I heard like, no. Or, you know, you're just, this is how you are. You just, you know, you have problems. It's like, no. It's just women need to be able to test and be encouraged to actually find out what is right for their body and how to move forward in that. So that's really why I'm doing this. I fought it for a long time. I have lots of other career aspirations in life, but I started doing this because this really ticks me off that women are still told, you know, like, well, just live with it, or, you know, well, you're just a sensitive little thing. Like, these types of comments are just driving me nuts. So I'm like,
No,
okay, we got it.
period pain is not normal. Yeah, that's your body telling you there's something underlying to investigate. So do take it seriously.
Yeah. And like, don't listen to other people who don't take it seriously. In fact, I
Yeah,
tell
PMS is
girls,
not a normal thing.
yeah, no, it's like, go figure it out, and you'll find people like Dr. Shreya Soni that will help you figure it out, because that's what you do. So thank you so much for answering all of our questions. And anything else you want to add that I didn't cover? Or?
That was great. We hit all the key points that I wanted to discuss. I will. This has inspired me in many ways, so I'll keep posting on endometriosis on my Instagram, and you do as well, and as well as my website, so dr-soni.com. So if you want to stay in the loop, I already have a post there on nutrients for endometriosis and diet for endometriosis. So it's called What You Need to Know About Endometriosis is the name of the post. And there's a whole even example first appointment on my website, but I'm just going to keep churning out the tools for people to help them heal.
That's awesome. Well, we appreciate it. We thank you so much for all of your, like I said, your experience and your wisdom. We're so excited to have you in our community. And for me, if anybody wants extra support, you know, to go through this process, because I know it's a long journey for a lot of us, I have a support group on Facebook, and actually I linked it on my Instagram. So you can just go click on my bio and it takes you straight to the Beyond Endo Facebook group, where we're all supporting each other. Just this week, we had like women from around the world join. I'm kind of